Ladies and gentlemen, I'm Joseph Atick, Executive Chairman of ID4Africa, and it's my pleasure to welcome you to LiveCast number 60. We're pleased to be bringing the LiveCast back with an important and timely topic on civil registration in Africa, progress, policies, and potential. Our episode consists of 4 segments. In the first, we will get a report quantifying progress made in birth registration on the continent, followed by insights on what it will take to reach universal coverage. Next, we will hear about the policies that have driven this progress in 4 African countries. We will then get updates on 2 calls for action we had previously launched with our partners, the ACSA initiative for harmonizing CR practices in Africa, officially launched in 2023, followed by another update on infant biometrics, launched in 2019, which, if validated, could have significant implications to legal identity from the start and beyond. So stick around. This is going to be a very interesting episode. I'd like to emphasize that we will begin our discussions on civil registration here today, but the dialogue will continue in less than 2 months in our upcoming annual general meeting, AGM, in Africa's political capital in Addis Ababa, Ethiopia. Before we begin today's exciting episode, I'd like to take a few moments to share some important updates on our AGM. This year, overarching theme, digital identity at scale, prioritizing use, accelerating impact, underscores a critical reality. Identity management must reach population scale to be truly impactful. But to do so, identity must empower high-value use cases for all. The essence of this theme will permeate throughout our program modules. Underlying this overall theme, several topics will be explored. Unpacking the program reveals how the 57.5 total hours of the program are distributed thematically. As you can see, significant amounts of time are dedicated to digital identity, to governance, development, and guardrails, to civil registration and legal identity, to DPIs and DPGs, to data protection and privacy, and to use cases, specifically financial sector. We will also be covering health and social protection, but to a lesser extent. Let us see how the program is organized over the 4 days of our event. We kick off the AGM with plenary sessions on day 1. Then with day 2, we bifurcate into 2 tracks starting in the afternoon. And on day 3, we bifurcate even further to 3 tracks all day long. We then go into 4 parallel workshops on day 4. Adding parallel sessions in the core program is necessary this year to cover the richness of the topics and to give voice to the broadest set of stakeholders. Simply put, there is so much going on in Africa at the moment that we cannot cover it using a linear pathway. Descending 1 layer down, we can see more of the topics we are addressing. Keep in mind, each session consists of multiple segments. On day 1, we start with digital identity progress reports in Africa with 11 featured African countries, and then we re-examine the development agenda from many different angles in the age of DPI and standards. On day 2, we look at use cases in finance, health, and travel. Then we explore DPI for development, a topic that has been attracting lots of attention lately. We also have a very significant session dubbed Data to Dignity, which looks at legal and policy reforms to ensure that digital identity does no harm and that no one is left behind in this fast-evolving digital world. It also features voices from prominent civil society members of our community. On day 3, we run 2 full-day and 2 half-day symposiums. The first is on digital identity, and it begins with an overview of worldwide adoption, exploring along the way the key elements needed to build robust and trustworthy digital systems, identifying as we go along their vulnerabilities. This includes fascinating segments on biometrics and liveness detection. Next, we take a data-centric viewpoint, examining interagency data sharing platforms, as well as digital wallets for better consent management. We then explore the diversity of digital credentials with presentations and insights from ISO, IKO, and W3C, before concluding with an in-depth analysis of the data risks associated with digital identity. The second full-day symposium is dedicated to legal identity, which is essentially a continuation of today's LiveCast. It begins by exploring the continental progress in this domain driven by decentralization and digitalization, and then continues by looking at the synergies with health and ID. In the afternoon, the focus will shift to how legal identity empowers mobility and migration, highlighting also the challenges that arise in this context. Key issues such as statelessness, refugee identity management, and the risks of double registration will be addressed along with strategies to overcome them. The half-day symposiums run on track 3. The first one is the continuation of the DPI and DPG dialogue from day 2 and runs in the morning. It covers concrete use cases of leading DPGs such as Open G2P, MOSIP, Open IMIS, Digit, and Open SPP, and explores the safeguards for DPGs and DPIs. In the afternoon, we will have the half-day symposium on digital identity in the financial sector, where we bring in the central bankers to talk about how they are using digital identity for financial inclusion and KYC, followed by a session on building the financial stack. On day 4, we run the following 4 workshops. Workshop 1 is an exciting session on trust services as digital public infrastructure and will be chaired by the World Bank. Workshop 2 is an exceptional summit for data protection authorities, DPAs, bringing together representatives from nearly 30 African DPA offices. This gathering provides a unique opportunity for DPAs to exchange best practices, align positions on data governance and privacy, and foster greater harmonization across the continent. This workshop is chaired by the World Privacy Forum and is by invitation only. Workshop 3 is a groundbreaking initiative aimed at transforming stakeholder dialogue. It seeks to foster collaboration between civil society and government, moving beyond adversarial dynamics that have historically shaped their interactions across the continent. It will be chaired by UNDP, ICER, and Co-Develop. Workshop 4 builds on last year's most popular session, diving deeper into the critical decision-making process of build versus buy in digital solution development. It will explore when to develop in-house, when to procure off-the-shelf solutions, and when a hybrid approach is the best fit, moving beyond the traditional procurement models. This workshop is chaired by UNDP. The workshops are much more interactive than the core program sessions and are less structured to allow for more discussions, brainstorming, and networking. Stay tuned to our communication channels as we release more information about them getting closer to the event. Let me remind you that the world's largest ID4D exposition will also be present during the first 3 days, where over 110 innovators will be exhibiting their latest solutions. Finally, it's interesting to compare this year's program to last year's in terms of scale. The core program, spanning the first 3 days, has expanded by 78% in total hours, while the number of segments has surged by 110% to 56. More significantly, the number of African speakers has doubled, and the number of featured African countries went up by 60%. These figures tell a powerful story. They highlight not only the growing intensity of our agenda as we give voice to all key stakeholders, but also the remarkable progress happening across Africa. The continent is taking ownership of its identity development, equipped with the expertise and experience to lead the conversation. This is a transformative moment. You will be hearing more about Africa, from Africa, in Africa. Without a shadow of doubt, this year's program is richer than ever, and it reaffirms our commitment to putting Africa first. We don't have time today to go into further detail about the program, so I encourage you to explore it yourself and uncover many fascinating dimensions. Think of this program as an ecosystem, rich, dynamic, and interconnected. The program was published over a month ago. The link is in the chat, along with the speaker lineup for the core program, excluding workshops. We're incredibly proud of this distinguished group of world-renowned practitioners and ID4D experts. But this is just the tip of the iceberg, with over 2,000 attendees expected, many of whom are highly experienced leaders in their fields. The event offers an unparalleled opportunity to engage, interact, and network. This is the power of the ID4Africa community coming together in Addis, ready to connect and collaborate. If you're interested in attending this year's AGM, you need to hurry up and register, as capacity is limited. 60% of available spaces have already gone. The registration link is also in the chat. I'm looking forward to seeing many of you at the AGM. Back to today's topic, civil registration in Africa, progress, policies, and potential. Before starting, I'd like to reiterate ID4Africa's position on civil registration. Beyond being the cornerstone of child protection, a cause we strongly support alongside partners like UNICEF, UNECA, and World Bank, civil registration is the foundation of legal identity, as we all know. But we go beyond that to assert it should be the bedrock for establishing national digital identity. Birth registration provides identity with its immutable evidence of existence, which bestows upon individuals their legal status and rights. I encourage you to revisit LiveCast number 13, link is in the chat, where I explored this critical topic in 2021 and even proposed a definition of legal identity. ID4Africa remains committed to advocating civil registration as a fundamental pillar of our ongoing digital transformation and ID4D agendas. We're now ready to start this episode. I'd like to welcome, in the order of appearance, Claudia Cappa, Senior Advisor, Statistics, UNICEF; Bhaskar Mishra, CRVS and Legal Identity Specialist, UNICEF; Patricia, Mpuya, Registration Manager, Registration, Insolvency, and Trusteeship Agency, Tanzania; Ago Christian Kodia, Director General, National Agency for Civil Registration and Identity, and ID4Africa Ambassador, Côte d'Ivoire. Operator, are the speakers able to join?
Yes, Dr. Atick.
Okay, they're being brought to the stage because they are not being updated on the screen. Okay, Paul Dume Mwangemi, Secretary, Civil Registration Services, Kenya; Mohamed Mubashir Massaquoi, Director General and Chief Registration Officer, National Civil Registration Authority and ID4Africa Ambassador, Sierra Leone; Karin Heisler, Regional Child Protection Advisor, West and Central Africa Regional Office, UNICEF; Josephine Mukesha, Director General, National Identification Agency and ID4Africa Ambassador, Rwanda. Josephine is on mission, but she will join us at the time of her segment. Abdon Marius Mikpon'aï, Director of Civil Registration Directorate and ID4Africa Ambassador, Benin. Judge Lydia Majima from Brazil was called in for a session last minute, but we are fortunate to have Felipe Artegas Hey, the judge's chief of staff, to give the presentation on her behalf. Warm welcome and sincere thank you to all the speakers for being with us. We truly appreciate your valuable contributions to this livecast and to the cause of legal identity for all. We're now ready to commence the first segment. Operator, please prepare the segment. In this segment, we will have Claudia and Bhaskar. Claudia and Bhaskar, please join us. Okay, Claudia, the stage is yours.
Many thanks, Dr. Atick, and good morning, good afternoon, everyone. It is my pleasure to share with you today the results of latest UNICEF estimates that were released in December of 2014 about birth registration. Let me start by saying why in UNICEF we are committed to supporting the monitoring of SDG 16.9. Well, it is a responsibility that was given to us as part of the mandate of different custodian agencies to support countries in the collection and analysis of data for core SDG indicators. UNICEF is the custodian agency for the SDG related to birth registration. This role is critical and includes supporting countries in generating, analyzing, and using data on birth registration. We are also responsible for supporting methodological work and developing international standards. We have the responsibility to establish mechanisms for compilation and verification of national data. And subsequently, we are responsible for maintaining global databases on the levels of birth registration. And on the basis of country-level data, we are responsible for producing global and regional aggregates. But it's very important to underscore the fact that these are not UNICEF data. These are data that are produced by the official authorities responsible for the production of statistics in the different countries. So in other words, the estimates that I will share with you today are the basis of national statistical offices in the different countries in Africa, and of course, beyond Africa, that have the responsibility for monitoring the Sustainable Development Goal commitment. UNICEF compiled this data, but again, these data are produced nationally by the different statistical authorities existing in the various countries. So what is the current data telling us? When it comes to birth registration, the latest available data underscore the fact that the world has made significant progress in advancing every child's rights to birth registration. According to our latest estimate, globally, about 8 in 10 children have had their birth registered in the last 5 years. This is a global estimate, but there are significant variations across regions. In sub-Saharan Africa, just over half of all children under the age of 5 are registered. As you can see from this graph, current birth registration level among the population of children under the age of 5 in sub-Saharan Africa stand at 51%. In other words, 51% of all under 5 children in sub-Saharan Africa had their birth registered. Now, let's look at the overview within Africa across the different regions. And I want to underscore the fact that we are following the official SDG regional classifications that arrange Africa according to these four main regions: Western Africa, Middle Africa, Southern Africa, and Eastern Africa. Across subregions, Eastern and Western Africa trail behind, with both less than half of children registered. As you can see, in the case of Middle Africa and Eastern Africa, the level of birth registration among the population of children under 5 stands at 41%. So less than half of children in these two regions are registered. Within Africa, the subregion with the highest level of birth registration is Southern Africa at 88%, followed by Western Africa at 63%. What is also important to look at is the level of birth registration across countries. And you can see that the countries with the lowest level of birth registration are essentially located in Central Africa and Eastern Africa, including countries like Ethiopia and Zambia, where the birth registration level remain among the lowest in the Sub-Saharan Africa region. Now, let's talk for a second about what this translates in terms of millions of children. So of all unregistered children worldwide, more than a half, or 90 million, live currently in Sub-Saharan Africa. So again, more than half of all unregistered children worldwide are African children who are currently living in Sub-Saharan Africa. This is the distribution of the all unregistered children worldwide according to where they live. And as you can see here, In blue, you have the number of unregistered children who are located in sub-Saharan Africa, and currently this number stands at 90 million. Now, within sub-Saharan Africa, the largest number of unregistered children can be found in Eastern Africa, where you can see there are 43 million unregistered children. So if we want to make the difference in the world in terms of ensuring every child rights to registration, we have to focus on where the unregistered children are. And as I mentioned earlier, more than half are indeed in sub-Saharan Africa. We also want to share with you the levels of registration among infants. So looking at the population of children under 1, because as we know very well, timely registration is critical. So children need to be registered as soon as they are born. Now, when it comes to the level of registration among children under the age of 1, we can see that levels tend to be lower. Worldwide, we have about 71% of infants who are registered. And when it comes to sub-Saharan Africa, this proportion is just about, essentially, it's just about 4 in 10, with significant variations again across sub-regions in Africa. And we can see that in Middle Africa, only 36% of children under the age of 1 are registered. As I mentioned at the beginning of my intervention, levels have improved over time. Over the last 15 years, sub-Saharan Africa has made steady advances to raise the level of birth registration, with the strongest gains in Western Africa. In Western Africa, level of birth registration went from about 42% in 2008 to 63% in 2023. Is this progress enough to reach universal birth registration by 2030? No, unfortunately, it's not. Despite recent advances in some parts of the region, the SDG target of universal registration remains out of reach. This graph shows the historical trajectory between 2008 and 2023, recognizing the progress that has been made. However, to reach 100%, investments need to be scaled up and intensified. Even with accelerated progress, the promise of universal birth registration could still fall short in 2063. So we have to definitely scale up and intensify the efforts if we want to fulfill the promise of registering every child. I wanted to also show more complex graph that show at the possibilities ahead of us. These graphs show the number of unregistered children in sub-Saharan Africa and overall in the world, according to 3 different scenarios. And we're talking here about number of unregistered children in millions. So the first scenario presuppose that the prevalence of birth registration remains at today's level going forward. If this is indeed going to happen, what we will see is that the number of unregistered children will continue to grow exponentially. Why? Because of demographic growth. So the current level of unregistered, the current number of 90 million could become 119 million in 2063. On the other hand, if the progress we have observed in the last 15 years continue as it has been at the same pace, the number will go from 90 million to 44 million. It will be cut by half. But if progress accelerates, if countries in sub-Saharan Africa follow the example of the countries in the region that have made fastest progress, the number of 90 million can drop down to 17 million, which will still be unacceptable, of course, but will be significantly lower of what it could be otherwise. So that's a call to action. That's a way of saying it's possible to reduce the number of unregistered children significantly, but efforts have to be intensified. We have a dedicated pages on our website where you will find the latest statistics on birth registration. It's under the UNICEF dedicated website for data, which is data.unicef.org. You will find a dedicated page on birth registration with the latest data publication and statistics. So I encourage you to have a look. And of course, I will be more than happy to answer any data question that you might have. Thank you so much.
Thank you, Claudia. We will be taking questions at the end after Bhaskar presents as well. So let me remind you, if you have any questions, please put them in the Q&A through the Zoom platform, and I will address them to the speakers. So Claudia, stay with us, but let's give the stage to Bhaskar. Bhaskar, thank you for being with us.
Sir, could you, thanks. Great presentation, Claudia, and thank you, Joseph, for the opportunity. Can we go to the next slide? So colleagues, let's shift our focus from numbers to strategies and calls to action that will catalyze Africa's journey towards universal birth registration. From a bouquet of strategies, the top 6 that we believe are the most critical are listed on the slide. Given the legality of civil registration processes, removing discrimination in law, policy, and practice should be a non-negotiable requirement and the foundation of other strategies to reach the entire population, everyone, everywhere. Legal identity leads to legal equality, a key pillar of the leaving no one behind agenda. We need to pay more attention to legal reforms and more specifically to their implementation on the ground, particularly in addressing instances of de facto discrimination. Together with the health sector to bridge the gap between birth registration and routine health services, decentralizing services to bring registration closer to the community, simplification of business processes to ensure registration and certification are done in one step, one visit, and optimizing the power of digitalization to enhance the accessibility and efficiency of services have been instrumental in the journey so far. We must continue investing in these game-changing enablers, but they work best when implemented as a package, not in isolation. We have good examples and bad examples. It is also important to embed them in broader strategies as the context and modalities of implementation vary from one country to another. Targeted interventions are essential as we know which countries and areas within a country require more attention. Out of the top 10 countries with the highest number of unregistered children globally, 7 are from Africa. Nigeria, Ethiopia, and DRC are the top 3 from the continent. More than 20 countries have under 5 birth registration rates between 75 and 99%, and they require last mile strategies to reach 100%. Some of them, such as South Africa, Namibia, Kenya, and Ghana, have been hovering in this range for several years, so they need to step up. The developmental aspects, the gains or losses of investing in or not investing in CRVS systems need to be presented in simple and understandable terms to capture the attention and support of decision makers. Everyone knows that the cost of action in CRVS is less than that of inaction, a point that has been discussed numerous times at ministerial conferences and other platforms. Still, little progress has been made in generating actionable evidence. Additionally, the most effective way to create demand for civil registration is by empowering the community to demand these services as a right. There is hardly a need to re-emphasize the criticality of a comprehensive approach, moving from a fragmented, siloed, and truncated approach to a comprehensive, inclusive, and country-owned, yet continental approach. Africa has numerous homegrown and tested innovative practices that countries can replicate. Let's take pride in these innovative practices and utilize them to their fullest potential. Finally, it is an opportune time to showcase how CRVS can serve as the foundation of digital public infrastructure. We should not miss this great opportunity, as the cost of not being part of this conversation will be huge. But are we ready to deliver what is expected of us? This is a question. This requires establishing universal, interoperable, inclusive, and digitalized systems. There is still much to be done in terms of leveraging CRVS as a tool of public administration. Rwanda and Sierra Leone have made significant strides in this regard, and others must follow. Can we go to the next slide? It is time to go back to the basics. Register every child at birth or immediately after birth, not later than the legally permissible window. The gap between under 5 and under 1 registration rates remain a major concern, with newborn registration on the lower side. The key is to reverse this trend so that no backlog of older unregistered children is generated. Clearing the backlog has become a vicious circle, and that takes away the focus from under 1 registration. Timely birth registration lays the foundation for a life cycle approach to legal identity from birth to death. Besides Algeria, Tunisia, and Botswana, which already have 100% birth registration coverage, only 2 countries, Malawi and Sierra Leone, have under 1 registration higher than under 5 registration. For others, the gaps are significant. Registration at birth plays a pivotal role in facilitating the issuance of unique ID numbers during birth registration, thereby establishing an organic connection with national ID systems from the outset. This is also essential from the perspective of establishing the life cycle approach, as we need a connector. Registering every child at birth is also crucial for aligning CR with health and national ID systems, thereby paving the way for establishing a health CR and ID pathway. This will ensure that the routine health sector data is used for notification and declaration, and that the birth registration data is shared with NID systems in real time, promoting the principle of collect data once and use it multiple times. This will help bring about structural and functional synergies among the 3 systems by eliminating numerous systemic and financial redundancies. Next slide, please. Any CR reform process must begin with a thorough review of the registration business process to establish a one-step, one-digit approach to registration and certification. This will make the entire process more accessible and affordable by eliminating the need for multiple visits to CR offices and addressing the gap between registration and certification. Globally, 55 million under 5s and 16 million under 1s registered children lack a birth certificate. To establish a one-step, one-visit system, there should not be any registration fee, and the first copy of the birth certificate should be provided free of charge. Otherwise, parents will have to pay an extra visit to CR offices or service centers to complete the process, and in some cases, just to collect the birth certificates. Equally important is to simplify the late and delayed registration processes, as they invariably require witnesses and additional documentation. In Francophone countries, court orders are required immediately after the expiration of the legal registration window. In other countries, it applies for delayed registration. In either case, the costs associated with court orders are exorbitantly high. For example, in DRC, it can cost between $80 to $100. Additionally, there are fines and fees associated with certificates, making the direct costs prohibitively expensive. Parents or applicants often need to visit main CR offices and courts multiple times, significantly increasing indirect costs. Unauthorized players further exploit this situation, resulting in additional financial burden. Streamlined business processes are also critical to avoid inefficiencies during the digitalization processes by adding extra steps or requirements such as NID of parents without addressing the supply side issues. Next slide, please. Embedding birth registration services in maternity wards is the most effective form of integration with the health sector. This provides a ready-made platform to ensure that babies are registered at birth and mothers can go home with the first copy of their birth certificate. Humanization desks provide another opportunity to register babies who could not be registered at birth due to delays in naming or other reasons. They can also effectively register the births of babies born at home. as 30 to 35% of all births still occur at home in Africa. Since this type of engagement may not be feasible in all countries or health facilities, especially smaller ones, the responsibility for declaration can be delegated to health staff in such cases. In that case, parents need not travel to the main CR offices, as the health sector will liaise with CR offices on their behalf, alleviating concerns about distance and cost. Community health workers and social service workers can act as a bridge between the community and CR offices by declaring births or facilitating declarations for home births. They can also help identify unregistered children and refer them to the CR offices. This is one resource that has not yet been adequately utilized. Schools provide unique opportunities to identify older unregistered children and facilitate birth registration by referring them to CR offices. School teachers can also register births as an interim measure or as part of a campaign. We have so many models in Africa to follow. Social protection interventions are another opportunity to identify and refer unregistered children to CR offices. Can we go to the next slide, please? One of the essential requirements to make CRVS systems inclusive is to allow mothers to declare births independently. Remove the requirements of a declaration only by the father or by both parents. Such a practice will enhance the efforts to register babies at birth and move towards a one-step, one-digit process. For single, unwed mothers and children born through sexual assault, including rape, the requirement of a father's name should be removed. The need for parents' marriage certificate should not be a prerequisite for birth registration. Relax the conditions for parental documentation in humanitarian settings, especially for migrant and displaced children. A child's birth should be registered by keeping parental data fields blank and avoiding entries such as unknown, not known, or by putting crosses. Such entries will attract the provisions of amendments as and when parents will have access to those documents and will create further complications for them. Ensure that birth certificates only contain information in the child's best interest, omitting sensitive data that could be misused. CRVS records must not be used to penalize individuals as they are not public documents. Protect sensitive data in CRVS systems from misuse or repurposing, particularly in immigration enforcement, through robust and adequate data protection and privacy measures. Legal reforms should focus on making CRVS systems inclusive and equitable that are aligned with the specific needs of vulnerable populations, have sufficient safeguards to prevent exclusions induced by digitalization or otherwise. Next slide, please. Have a well-planned approach to community engagement. The key is to create an environment where civil registration services are understood and embraced as a fundamental right, educating citizens as well as residents on the importance of birth registration for accessing services and protection. Some populations, including refugees, internally displaced persons, these stateless still face significant barriers to accessing civil registration services. Therefore, targeted steps are needed to bring these groups into the CRVS fold by making services more accessible and empowering them to understand and demand their right to registration, ensuring they are not left behind. Strengthening partnership with local leaders, faith leaders, health workers, and educators is crucial to promoting the value of registration and securing their support to enhance the uptake of birth registration. The goal ultimately is to cultivate a culture where civil registration is viewed as a fundamental right and a shared community objective. Thank you very much, Joseph.
Thank you. Thank you, Bhaskar, for this fascinating analysis. And of course, Claudia, your presentation. Actually, Claudia, join us back on the screen, please. First of all, a lot of people are asking to have access to your presentation and the graphs and the figures, etc. Could you please tell them where they can get it? Of course, anybody that sends us an email asking for it with your permission, we would be happy to share it. But in general, where can they find this specific excellent set of data?
Thank you so much for the question. Of course, I will be happy to share the presentation, but also the content of the presentation is available in a dedicated publication that we just released this week that is specific to Sub-Saharan Africa and includes all the graphs that I presented and many more. So the presentation is available on data.unicef.org. There is a dedicated page on birth registration under which they will be able to find the presentation I mentioned, the publication I mentioned, as well as all our databases.
Okay, thank you. That's great. I'll come back to you with another question, but Bhaskar, there seems to be quite a bit of questions from the pre-registration that kept saying, we need to create demand for birth registration before we would see motivation by the countries to move forward with bigger investments in birth registration. How would you answer that question?
So, Joseph, this is a very pertinent question that we have been hearing for decades.
Right.
My simple answer is that if you simplify the supply side issues, there will not be any problem for demand creation. This is what I have seen, like in most countries, in India and also countries in Africa. So we need to focus more on simplifying the supply side challenges, and that will entail, like everything that I have presented in my presentation. And that is the key. That is the short answer that I will give.
So you're not advocating, for example, making birth registration a necessity for vaccination, or making birth registration a necessity for schools, and so that I know some countries have made that and they've shown some results, but there is the exclusion challenge that comes with that. So how do you feel? What you're saying is get the supply side so that there will be no exclusion, but then birth registration will have applications, will have a demand.
So they are also supply side actors, like civil registration cannot stand in isolation. On one side, you have health, on the other side, you have national ID, you have social protection, you have education. So what I mean by sorting out supply side challenges that make all these systems interoperable and utilize opportunities that come from those interventions for identifying unregistered children, referring them to civil registration, and if possible, also help them to register on site.
Mm-hmm. The approach that we are taking at ID4Africa, obviously you're very well aware, but to share with the general audience, is that we do believe that civil registration is the bedrock of digital identity, because at the end of the day, you're talking about adult rights that are basically being debated and being argued because there is no link to civil registration. Do you think if we succeed in campaigning to make it clear to the governments and the countries that all the ensemble of rights that you're talking about would be much less conflictual, that will be less conflict if there was a very robust and trustworthy birth registration system?
Of course, that has to be the starting point. That's why we have started paying more attention that every baby, every child should be registered at birth. Because if the birth of a child is not registered, like what kind of challenges the child will face, not only at birth, throughout the life of his or her journey.
Right. So legal identity from the start, and we're going to be talking about that throughout the sessions. Let me go to Claudia. Claudia, there has been at least one question, and also from the pre-registrations, which talks about what efforts has your organization made to speed up civil registration of children, or even report on civil registration in children in conflict zones such as Eastern DRC and Ukraine? What reforms need to be initiated to avoid delays, for example, in registering children? What is your perspective on that?
Well, thank you for the question. My responsibility within UNICEF is about data. So I can speak about the efforts that we make in terms of support, collection and analysis. My colleagues working at the programmatic level, they have a tougher job of really supporting the actual registration. So I'm not best placed to answer the question, but there are definitely colleagues from UNICEF side, including Bhaskar, and the colleagues who will speak later, that can provide a response to the questions about what UNICEF is doing on the ground.
But turn it around. You're talking about data. Can you explain how do you collect data? And in conflict zones, are you still accessing data?
So UNICEF does not collect directly data on birth registration. It's the national authorities, so it can be the National Civil Registration System or the National Statistical Office. They have the responsibility for gathering the data. UNICEF provides financial and technical assistance in some cases, but it's very important that we underscore the importance and the significant efforts put by countries themselves in monitoring birth registration, which is in itself an important demonstration of the commitment the governments have towards achieving the SDG goal of universal birth registration. So most of the data that are available on birth registration come from household surveys, like the multiple indicator cluster survey or the demographic health surveys. This type of survey obviously cannot be implemented if the conditions are not in place for the safe collection of the data. So in conflict-affected situation, at times, it's impossible to deploy interviewers who conduct these door-to-door interviews. So when there is a conflict in the countries, either the data collection is halted and postponed to when conditions are allowed, or some of the regions are not captured in the samples. So we are trying to maximize the coverage and therefore go back to when data collection is happening, but data collection cannot put interviewers or family at risk. So in this case, we have to wait until the conditions are ready for data collection to take place.
Okay, understood. And Bhaskar, there's a very pointed question to you. Bhaskar, having to reduce some of the information, especially for children of single mothers or children born as a result of sexual violence within armed conflict zones is an amazing recommendation. Is there any country who is able to absorb such legal reforms? If yes, it would be great to have more information. Do we have any information about this, or is this a suggestion?
In case of sexual assault and rape, I think countries have started moving in that direction. We are working on a document that should be released next month that will have a lot of practical recommendations, and that will also answer the question that you asked, Joseph, that what should be done in humanitarian conditions. Okay. And if I know for sure that there are a couple of countries, I know for India for sure that if you go and say that these are the situations, they will register your birth. And I also know the system in Kenya is very, very flexible. Okay, that I know for sure. Okay. And what I also saw in Tanzania that, like in those cases, they are very flexible. So Patricia is here and she can, like when she talks, she can also address this system. Thanks.
Okay. I'll come back to you with another question, but I want to ask Claudia. Claudia, listening to your fascinating data and looking at, especially you're talking about not even 40 years. So we're not talking 20, 30, which is in few years, even 40 years, we're still having a problem. So this should be a wake-up call for all of us. That the world has to mobilize at the highest levels, because data doesn't lie. Data is really telling something very, very powerful. Let me ask you, could you compare the current situation where we're in today to when you started working at UNICEF and looked at the world? How did we evolve? Are we just slowly closing the gap and therefore it's going to take us another 40 years? Or do you think progress in data happens abruptly, and so all these projections are not really relevant because they tell us where we are today, but they don't tell us where we can be tomorrow?
Well, I started in UNICEF 20 years ago, and over the last 20 years, I witnessed two things. First of all, increased investment in data. And when I say increased investment in data, I'm not saying more data collected, better quality data collected. So even in the case of birth registration, the way in which we collect the data, the question that we use have evolved. Because obviously there was a lot of confusion at the beginning in terms of the concept of registration itself.
Yes.
Even the data collection reflected this confusion between an actual registration with a civil authority versus a declaration of the birth existence or happening with the hospital. So we have made progress. And when I say we, I'm not referring to UNICEF, I'm referring to us as a global community. We have made progress in fostering the quality and availability of data on birth registration. And the second element that I witnessed in my 20 years is that there has been progress in increasing the level of birth registrations. Now, how do we expect this progress to happen? It cannot happen overnight. Because obviously what we are witnessing at the same time is an increase in the children that are born in countries in Africa. So that the challenge that Africa has is also determined by the demographic growth. So that's why the progress is very important, because not only they've been able to maintain the level of registration, but they've been able to increase it with an increasing population of children under 5. This demographic element should be really appreciated, because the challenge keep growing in our.
Yeah, but I mean, I'm hoping that there is going to be some actions that will make all our projections wrong, like the data models for predictively.
It's nothing that I can wish for, that all my projections are actually wrong, because
Yes.
I would like every child to be registered, not in 2063. At the time, I will be doing something else with my life, but I'm going to be around in 2030, and I want to have a report in 2013 saying that there is child.
So let's take it as a call for action to break Claudia's models, to just make sure that her predictions are wrong. We love you, we love what you do, and you keep informing us, but we must break away from this picture that it's going to take us 40 years. None of us will be around to actually in this career to see this progress. So this is an urgent call. Thank you so much for that. Bhaskar, one other thing that seems to be recurring a lot, there's a lot of confusion about digitalization. We talk a lot about digitalization, and people keep saying, you know, some countries invest their money in actually scanning birth records. Other countries spend their money in actually building an information system to capture the declarations and then therefore the registration. So for you, when you talk about digitalization, could you please give, if you have a recommendation, what is your recommendation for digitalization?
So, Joseph, when we talk about digitalization, what we mean is to automate the civil registration process. Okay, not only about scanning all or, like legacy documents, that's all about digitizing. So when we talk about digitalization, the idea is to use digital tools for, like capturing data at source. Okay, and then digitalization can help, like across the entire course of starting from notification, declaration, registration, certification, archiving, etc. My recommendation would be, let's not be very ambitious. Let's not go for end-to-end digitalization everywhere. Be cognizant of practical challenges, logistical challenges, and then wherever you have issues, go for digitalization at the next step.
Okay.
What I have seen, most countries, there is a tendency to rush for digitalization, and then finally they get caught up. And then you will see that those efforts are localized, like in capital cities or big towns. Okay, so we need to have a plan, piloting to scaling up plan. That is what is needed.
Okay. Okay, Bhaskar and Claudia, once again, thank you so much. We're running out of time for this segment, but I'd like to ask you, there have been quite a bit of questions. If you offline or when you get off the screen, if you could just answer the ones that you think you can answer, so that we can keep the community engaged and informed. And of course, this conversation is going to continue at the AGM, where we have 7 hours worth of civil registration discussion that will take place. So thank you once again. Operator, we are now ready to move on to the next segment. Thank you. Okay, in this next segment, we are going to have with us the countries that are going to present sort of the policy analysis of what they have done, the policies that they have adopted, which led to improvements in their own countries, so lessons learned, etc. So we have with us Tanzania, we have with us Kenya, we have with us Côte d'Ivoire, and we have with us Sierra Leone. So operator, could you please invite our guests, of course, Karin also from UNICEF, who will give commentary about what she's seeing. So operator. Do we start with Côte d'Ivoire? Ambassador Kodia, the stage is yours.
Hello. Thank you, Dr. Atick, and thank you to everybody to attending this LiveCast. I'm going to speak in English. Maybe it will be not so quite fluently as we already heard from UNICEF, but I will try it.
You're doing a great job.
Okay, thank you, Dr. Atick. I will start by making an overview of the registration system in Côte d'Ivoire, and as you said, the importance of civil registration in all of Africa is going to be a very sensitive topic, and it's not only central for governance and development, but also to the dignity and the right of our people, of African people, of all the peoples. And in Côte d'Ivoire, what is the progress we made? Next, we can go ahead of the full presentation. Next, please. Okay. The progress we have made. I will start with the progress, but over the past decade, Africa has made significant strides in strengthening civil registration and vital statistic system. Many countries have adopted digital solutions integrating biometrics technology and centralizing national identity database. Côte d'Ivoire, for instance, have undertaken major reforms, including the digitalization of birth registration and the introduction of a unique national identification number. This initiative aligns with the African Union's Agenda 2063 and the UN Sustainable Development Goals, particularly the SDG 16.9, which aims to provide legal identity for all by 2030. To achieve these goals, what Côte d'Ivoire specifically done? We have two branch of actions. We have a political and the legal reform, but I put them together. But the first political action is the creation by decree of a national body responsible for coordinating all the civil registration and identity together. And this led naturally to the creation of ONECI as responsible of the coordination of civil registration and identity based on the biometric, with some advantages of like delivering a secure ID or for delivering a secure birth certificate. Next. Also, the second one was the adoption of a centralized digital registry, which called the National Registry. In Côte d'Ivoire, we call it the RNPP, which means Registre National des Personnes Physiques. And this is from this register, we took the national ID, which is the unique ID. It means that your ID from your birth certificate will be the same ID with your national identity card of your national resident permit or resident card. We have a deployment of, in terms of action, and the result this brings to us is the deployment of the national civil registration software with connection to IF center and the community focal point. Because community focal point, because we know that we don't have hospital in everywhere. In some areas, we have just a big village and the hospital is very far. So the law put some focal point. So the focal point also can take the registration of the people, the birth, and so that birth will be sent to the registration center, and that we can issue a birth certificate. Because at the sanitary point, the people of the hospital can also make the registration. Next, please. We have a reform is a legislative amendment to facilitate birth and death registration. To facilitate, because in Côte d'Ivoire, as you know, in the past time, we had some, I cannot say civil, but some problems. So that problem leads to some registers to be destroyed, or due also for the natural destruction of the register. Some of the register for the civil registration have disappeared. And some people also have not been registered. As we have a new system, by law, the government decided to make a sort of, I want to say grass period. So when people can come and be registered, if they are not only registered, we are sure that this new registration will be secure because it's been linking to the biometric system, making people only single in the database. As a result, we have people who have not been registered, or those who use fast birth certificate for many or do not use any regular birth certificate, they can come down to be officially registered. But the particular thing is without penalty, because by the law, if you make false declaration of you use false birth certificate, you can be guilty of some penalty, and I don't know, but not by the law, and you have been put in grace period. And this law has been extended for 3 over years because this system will not go pass off for the time. Next, please. And we have also, as a major progress, the introduction of the technology and the innovation policy. By the law, our civil registration was made on the hard copy. So we have some physical register in the registration center, maybe in Côte d'Ivoire is at the mayor office of as what we call here in sous-prefecture. And by the law now introduce the use of ICT to apply this to civil registration. So now we have some numerization of the register, and we are going in to progress to have finally only a I want to say an electronic civil registration database. And the result is the scan of all the birth book in progress and digitalization for the birth certificate, so people can easily move to a digital ID. Next, please. And finally, the new things and the major progress is the interoperability between administration database. So now we are moving to a period when people did not need to bring himself the information the government already have from the birth certificate. It means that we can share with secure policy the data between the administrations. This leads to have the same unique ID issued from birth registration to the ID system card. So the unique ID you have been granted to on your birth certificate will be the same unique ID you will use for your ID card from a permit, for passport, everything, and on we are going on. And we have been discussing to make an extension to the issuance of assurance card, driving license, of maybe tax office, and this is in progress. Next, please. Saying that all this implementation, what is the challenge, the major challenge we are facing due to operationalize all this progress? In terms of challenge, we can see that despite this achievement challenge, many challenges remain. Many African countries are also facing this challenge to have a registration coverage, particularly in the rural area or marginalized community. We have also the high cost of the system of the new system for the digitalization, and some legal barrier, we just talk of them, and institutional fragmentation in having many stakeholders in the term of registration. In Côte d'Ivoire particularly, we have some infrastructure problem for the implementation and connectivity, because the new system is depend of the connectivity, because we have a unique database. And we have also the limited access for digital, to use the digital system in the rural areas, have some, and some power supply problems also. And in terms of interoperability and data security, because we have many administrations using their own data. So using their own data means that they have to abandon their own data and move to the unique data, and this have to be implemented, and this still be a challenge. The term of harmonization of how we can make the matching between all the data is a big challenge. We have also the need of skilled person, because now many people working in the data or in the civil registration office are not computer literate, and we have to train them and have them to be used the new system. We call it in French. Maybe I will traduce it in change policy, because we have to change from the manual system to go to the new system. And the most challenging aspect of this is the aspect of the law, because by the law we still use the booklets to make the registration. But now, how to make people in with the law to say that we totally abandon the booklet and switch directly to the how can I say it, the electronic mechanism to register people. This continue to be a challenge. And also, we also have some cultural and social barrier, because in Côte d'Ivoire, sometimes before making the declaration, people need to celebrate. Making all we have to celebrate, we have to wait for the father to give the name, and without all this information, we cannot make a proper declaration. By the law said that we can change after, but this still be a challenge, because you have to make the declaration, and then after you can come and complete or make additional information. But people have to be aware of this. And we have also the funding aspect. So we need to have the funding aspect so we can have funds to continue to make the system sustainable, and have the government or all the people to be included in the progress of the system. And also we have, I just speak of that, the public awareness, so people can know what is going on and how to declare something. We call it in the big word of sensitization. Next, please.
Okay, Ambassador Kodia, just to
Yes.
let you know, we have about 2 more minutes.
Okay.
Okay.
Thank you. And then we have all this being to some direct impact. And next, please, I will show something rapidly. We will see on this graph, but the page I have underlined mean that in this period, when we make this law and sensitization, we notice that we have a big peak. We double or going to twice time the registration score we already have. Next, please. And all result also is the figure that we have instantaneously. So now we can have all the country, all the figure, all the data of birth, death, marriage, every wedding, everything we can have them instantly and share them between administration or stakeholder you use. We need this kind of data. Please, next. I already talked about it, but now we cover all the people, all for the country. We have been deployed the system at 84 registration center, and this is good. And we still going on. Next, please. Finally, what is the impact of this in the business? How people continue to do their business, the day-to-day business, the impact. We finally have efficiency in the manner of people is doing the business of, they can have the registration of birth certificate. This is faster. We have faster delivery, and then we can prevent fraud, and we have some authentication measure. We reducing identity theft and document falsification. And we have also some economic and social benefits, because people can be registered easily to the insurance of how we call it now in the public coverage of insurance. Next, please. And all the major transformation is now we are leading, because the two system is connected. So now we can have digital ID in Côte d'Ivoire. We just implement the digital ID and secure all those documents, like the national certificate, which is directly linking to the system, the national database. Next, please. And I will present you the software. This is the software. So we have some, just people have to put information and make the declaration from the hospital. And this can have, we have two type of machine we use. We have a mobile application, and you have also the web application for the mayor of the office working in the mayor office. I think that I have covered. Next we have last things. Yes, this is the presentation of the software and all the things we can have this with this software. Finally, I can say that a robust civil registration system is more than a tool for identity management, is a pillar for governance, security, and economic growth. In Côte d'Ivoire, we are still going to implement all the major challenge, and we still have some law to update, but we are still going on so people can benefit from the unique ID from the birth to the death. Thank you very much.
Thank you. Thank you, Ambassador Kodia. We're going to be moving to Patricia from Tanzania. We'll come back to the questions at the end if we have time. But Patricia, have we resolved the issue with the...
Yeah.
Okay, so you're back.
Can you hear me?
Yes, we can hear you. Wonderful.
Thank you. Thank you.
The stage is yours.
Thank you, sir. Good afternoon, everyone. My name is Patricia Mpuya from Tanzania. I'll be presenting on the policies that have helped us as a country to improve our civil registration system. Maybe a bit of background. Registration insolvency. Registration Insolvency and Trusteeship Agency, RITA, goes with the acronym RITA, is responsible for registering the vital events. Not only that, also to administer the deceased estates, incorporate trustees, act as a public trustee, and also deals with the matters of insolvency for both individuals and companies. As far as the vital events are concerned, we do capture the births, deaths, marriages, divorces, and adoptions. Next slide, please. A bit of a snapshot of our business processes in regarding the births and deaths. Well, in Tanzania, the registration of births and deaths is governed by the Births and Deaths Registration Act, Cap 108. Registration of these events have been ongoing since 1917. We capture both births and that occurs in the health facilities, as well as those in the community. So the improvements of our business process have successfully helped us to manage to capture every birth event that occurs. This slide shows the business process of when birth occurs in the health facility, and once the parent has a name, the child will be registered right there and then and issued a birth certificate. And if not, during the visit to for immunization, then the child also can be registered there. And as we know, in Tanzania, more than 80% deliveries occurs in the health facilities. So it's the right place to ensure that every birth is captured there. So as a matter of fact, if the parent does not have a child, a name of the child, then can register at the ward executive office, which is near to where he or she resides. Next slide, please. Just a bit of death registration, which we still on the improvement of our death registration. This is what we have envisaged, and we have managed to just escalate it in a few districts. We do also, just like in births and deaths, we do also capture the deaths that occurs in the health facilities, but also those which occurs in the community by using the health facilities as the registration centers and the ward offices as registration centers for those the community-based deaths. So narrowing it down on the innovations, policy innovations that has helped us to improve our CRVS system in the country. Next slide, please. In the country, as we are all aware that the accurate and comprehensive civil registration system is essential for many things: planning purpose, protecting individual rights, generating reliable data. So as a country, in 2013, we have embarked on different measures so that we can improve our CRVS system. And in front of you, you will see we have got 5 pillars. So these are the essential policies that we adopted that manage to improve our registration of births as well as certification. So to start with is decentralization. In Tanzania previously, the registration occurred in the health facilities, but later on, certification was done at the district level. We've got about 139 districts. So the district officers were the ones that issue the certificate once the birth is notified at the health facility or at the community. Now that proved that to be a barrier for many of the many of the citizens to access the services, because you will find the district office is located more than 100 kilometers from where people reside. So we did the decentralization, moved services more closer to the community by using the local government machinery that made possible for citizens now to travel 5 kilometers, not more than 5 kilometers, to be able to access the services. And from the 100 plus registration centers, we have managed to increase the registration centers to about 11,000. So you will see we've got many registration points whereby a citizen or a parent can just travel just near to where he or she resides and get the children registered in the health facilities for facility-based births, or at the ward offices for community-based births. Another factor, another policy is the adoption of one-step, one-visit process. You have heard Bhaskar talking about this. Prior to that, we did have multiple visits. A child was registered after birth in the health facility, but later on required to go to the district office to be able to get the birth certificate. Now, this made the certification rates to be at the lower rates, because you find many events are registered, but the certification rate was very low. Now, once we adopted this process that ensured that if a parent has a name at the maternity ward, the child is registered and the birth certificate is issued right there and then. And that has helped us to increase the rate of registration and certification of children, which occurs in our country. Another policy I would say is the fee waiver. Fee waiver, we managed to remove the fee to the first issuance of a birth certificate, and this has helped us to encourage more parents to ensure that their children are registered. Prior, we had a minimal amount. It was just a minimal, but with that minimal amount, it proved for some parents to be as a barrier for their children to be registered. So we did manage to waive, amended our laws and make sure that the first issuance of a birth certificate is issued for free. Again, another policy was innovation. So we have these many registration centers at the local government, at the places where people can now access it. But how can we how can we get the timely data? So we leverage it on the use of technology, data capturing using mobile phones. So all the registration centers were given the mobile phones with our birth registration application. So the registration assistants were trained. After registration, they are supposed to enter the information to our database via the mobile phones. So you will find that now we can be able to access and to get time registration of data from the registration points, which are very far away to the interior. And also together with that, we've managed to have a dashboard which can show now how the birth registration is progressing, regional-wise, district-wise, even in the health facility level or the ward facility level. So you can see, and it enables us to monitor the registration activities and see where we need to improve more, and ensure that every child is registered. Together with that,
sorry, Patricia, one moment.
yes.
You only have about 1 minute left, so we can
Thank you. I'm wrapping out. So together with that, the public partnership, also this enabled us to have more resources so that we can improve, implement our improvements. Next slide, please. So with all those strategies that we had, the policies that we adopted, it enabled us to move from the 16% registration of the under 5 children up to 68%. So now you see those strategies have enabled us to increase the registration rate, not only the registration rate, but also the certification of the children. So I'll say that these are the strategies which, if if are used properly, can help us more and can help other countries also improve their registration system. Next slide, please. Together with that, we've got, yes, this slide shows the impact that we had after adopting those policies. The registration rates went high in almost all the regions. Next slide, please. So that we've got few challenges, several challenges, social barriers, the cultures, naming the children before it's born. It has been proved to be a challenge for some of the places, and that can be a problem, because if we don't capture the child immediately after birth, maybe sometimes the parent may forget to register the child. So we advocate more on the parents to ensure that they have the names before they go for deliveries, so that they can be registered at the maternity wards and issued with the birth certificate. So thank you very much for listening to me. Thank you. I appreciate it.
Thank you for impressive results. In fact, I love seeing the decentralization working. I mean, you've really shown, not just in the center, everywhere else, your numbers have really gone up. Okay, so we're going to continue this rapid fire short presentations with Paul from Kenya. Kenya, the stage is yours. Please share your slides.
Yes, thank you, sir, and all my colleagues. My name is Paul Mwangemi, Secretary Civil Registration Services, and I'm delighted this evening actually to be given this opportunity to make a presentation on the 60th LiveCasts on ID4Africa, especially on high-level policy innovations, and of course the birth registration progress in Africa. Yeah, maybe we'll go to the second slide. I start with a small introduction. Civil Registration Services is actually one of the departments in the State Department for Immigration and Citizen Services. This is a state department within the Ministry of Interior and National Administration. The department derives its mandate from the Birth and Death Registration Act, that is Chapter 149 of the laws of Kenya, which is actually the primary act governing registration of birth and death. The act provides for the compulsory and immediate registration of all births and deaths occurring in Kenya without regard to nationality. What I mean here is, even if you are not a Kenyan citizen, and of course that event occurs in Kenya, we have the responsibility as a directorate to register that event. It also provides for optional registration of births and deaths of Kenyans occurring abroad. That is Kenyan citizen, where the events occur outside Kenya, they have that option to come and apply for localization or customization of that registration, and we do that and of course issue a Kenyan birth or death certificate. The act was enacted first in 2028 and has undergone several piecemeal updates, the last one being not in 2012 actually, but 2022. I'm sorry for that small mistake. Now, maybe we go to the next slide. We have the core functions of civil registration services. And before we do that, when it comes to civil registration, of course, it encompasses a lot of, it's not only limited to births and deaths, it also encompasses registration of marriages. We have divorces. But again, in Kenya, we are actually confined to registration of births and deaths. When it comes to marriages, there is another institution that is actually responsible for that one. For divorces, of course, is the justice system that is in charge of that one. And of course, when it comes to ID, national ID cards, we have again another sister department called the National Registration Bureau, which is responsible for that one. So civil registration services Kenya is only confined to the registration of births and deaths. So that is actually the primary function of registration of all births and deaths occurring in Kenya and of Kenya citizens occurring abroad. Then out of that one, we of course create registration records. And one of the primary responsibilities is actually to keep custody, to preserve and secure those records for future references. Issuance of birth and death certificates upon application, processing, analysis, and dissemination of vital statistics from registration records for evidence-based decision-making in the country, and re-registration of births upon legitimation and recognition. Maybe let me expound on this one. We have instances where we have mothers giving birth outside wedlock. By that one, I mean, we have parents or mothers who give birth when they are not married. Now, sometimes two things happen. When that one takes place, and the birth of that child is registered, because we don't have restrictions as to whether the mother is married or not. Even if that mother is not married, we still go ahead and do registration for that particular birth because it's the right of that child to be registered. Now, subsequently, if the biological parents of that child get married, then we are saying that the birth of that child has been legitimized. And for that case, there is a process where they come and apply for re-registration. And by that one, we mean there is a process that they normally undergo to make sure now the father's name is actually now put in the record of birth of that child to make that record now complete. That is what we are calling re-registration of birth upon legitimation. On recognition, again, it's actually the same process, but here we are saying the biological parents of this particular child may not be married, probably they are married to somebody else, but they want to recognize that particular child as their biological child. And for that case, as much as they are not married, they apply for registration upon recognition, that recognizing that child as their biological child, and upon application, we do re-register that birth by actually putting the father's name in the record of birth of that child and issue a birth certificate to that effect. That is exactly what we mean by registration of birth upon legitimation and recognition. Next slide, please. Now, quickly, we have achievements for 2023, 2024. This is just a snapshot. We managed to come up with the annual vital statistics 2023. And of course, the percentage, we did not do well, really. We had around 77%. And then we came up with a departmental strategic plan for 2023-2028, which highlights some of the priority areas that the department is actually intending to implement in terms of programs and activities. We had a review of legal framework, that is Chapter 149 of the laws of Kenya. And specifically here, we are talking of the regulations. Why we did this as a country, and of course as a department, we are actually tending towards automating our systems. And of course, the current acts and regulations was not providing for what we call electronic whatever processes or automated processes. And for that case, so as to achieve what we may call as quick wins, we went to the regulations which are actually operationalize this act to provide for automated operations of our operations. And that is why we revised, and of course, as we are speaking, the regulations were already gazetted and are actually in place. The primary act itself, that is Chapter 149, is in the process of being reviewed. We are still in the preliminary stages. We have had around 2-3 workshops, and of course, we have included some of our stakeholders in the process. Probably in the next 6 months or so, we should be able to have a new revised act, that is Chapter 149, to provide both for, there are some issues which we may call, of course, there is that automation aspect of it, but there are new issues that are coming in which were not foreseen earlier, like issues of intersex and all these other things which were not provided for. And it calls actually for looking for a total review of the act to make sure that some of these things, what we may call as emerging issues, are actually brought on board in this particular act. Then we have what we call the development and implementation of the UPI system. I'll explain further on this one. Onboarding of all civil registration services to e-citizen platform. This e-citizen platform is a government platform which was actually developed to make sure that all government services are actually offered through this platform, especially when it comes to application and payment for these services. And of course, one of those services which are critical are actually civil registration services, application for birth certificates and death certificates. As we are speaking, we are already on board in this e-citizen platform, and most of the applications are actually done through this platform, and the payment is actually done online. Now, over and above this one, as a department, we had a problem in terms of our spread countrywide, because out of around 400 administrative units, our presence was only in around 125 administrative units. For the last 2 years, we did around 37 offices more, and we are at around 167 offices. And in fact, we are in the process of opening more and more offices to make sure that we actually take these services closer to the people, because it's one of the issues that is affecting the registration performance in terms of births and deaths. The next slide, please. This is actually a snapshot of the registration performance for 2023-2024. Of course, for 2024, the report is almost ready, but it has not been officially published. And you can see that in terms of birth registration, we were at 77.1%. And for death registration, we were at 45.1%. We are not doing very well in this one. We still have challenges which we are actually supposed to surmount. Next slide, please. Now, we are going to the high-level policy innovations, which will actually assist us, and of course, some of them have already assisted us in improving our registration coverage in the country. One of them is the development and implementation of the unique personal identifier, that is the UPI system, and its rollout to all stations and Huduma centers. Huduma centers are just service centers countrywide. Now, this UPI system is none other than an automated end-to-end civil registration and vital statistics system, which will be able to generate a unique personal identifier, generate and assign a unique personal identifier to the newborns when they get registered. This number will be like a life number. Once that number is assigned, then throughout somebody's life, the same number is going to be used for other subsequent registrations, and of course for services delivery when this person actually procures any other service. For example, this number will be used for school enrollment, for registration of exams, at the age of 18 years, because in Kenya, we normally get the national identification cards at the age of 18 years, the same number, the UPI number, will now be used as the national identification number. And the record of birth of this child will be used now for the issuance of the national identity card of this person, apart from a few data elements which will be collected, like the fingerprints and, of course, by the biometrics of that person, and, of course, the facial impression, that is the face. Otherwise, in fact, this is the policy of actually collecting information once and making multiple use of that particular information. This system has already been linked to, of course, it has been partially developed. It's not fully developed, but for the part that has been developed, it has already been linked to our sister department, that is the National Registration Bureau. We have another department which is called the Integrated Population Registration System, which is like a central database where these registration agencies share the information, and we have other government agencies actually linked to that particular agency for purposes of sharing even more information and know your customer, KYC, especially for commercial related whatever agencies like insurance companies and, of course, banks. Okay, now the other one is digitization of all manual records. We have around 50 million of them. Completion of the legal framework. Opening of more offices, as we have said, we are targeting around 290 offices by 2027. Maybe we can go to the next slide. Next slide, please. We have what we call mobile registration of births in hard-to-reach areas and refugees camps. Implementation of maternal and child health strategy on birth registration, that is the notification of community births not notified by respective registration agents at home at the first point of immunization in health facilities. And of course, one of the issues is adequate supply of strategic registration materials, because we are still largely manual, and then partnerships with potential development partners to enhance the operations of civil registration services through what we call a national technical working group on civil registration.
Thank you, Paul. Thank you. Actually,
thank you.
Your numbers, 77%, much better than the numbers that we have seen from Claudia for East Africa. So you're a bright star. So thank you for that.
You, sir.
Thank you. Okay, last but not least, we're going to hear from Sierra Leone with Ambassador Massaquoi. Ambassador Massaquoi, the stage is yours.
Yes, so we're talking about progress and policy innovations driving change in Africa and Sierra Leone as a case study for our discussion today. Next slide, please. Now, we're looking at our progress in birth registration. We started registration, civil registration, particularly birth registration in Sierra Leone in the 1800s. But then it was more or less limited to birth and some form of death registration and marriage. And then going forward, after 1800, by 2010, Sierra Leone, in compliance with the vision of IPI, CRVS, UNECA, and African Union, and other partners, now saw the need for an assessment on the CRVS and ID management landscape that was undertaken in 2014 under the leadership or the guidance of Dr. Atick, as if he knew, Dr. Atick knew that he was going to form the ID4Africa movement. And so the information gathered from Sierra Leone must have been very much helpful for the establishment or the formation of the ID4Africa movement. So we're always grateful for the information gathered by Dr. Atick and his team in 2014 that culminated or urged government to adopt a policy on national policy, a policy on civil registration reform in Sierra Leone in 2014. That policy that government adopted in 2014 gave rise to the birth of the NCRA through the enactment of a legislation called the National Civil Registration Act in 2016. And going forward, after the establishment of the authority and following the enactment of the act, now we had in 2019, government and partners saw the imperative need to organize or to conduct what is called the comprehensive country assessment that is done by countries with guidance from ECA and our development partners, primarily the UN system and the EU and et cetera, et cetera. Ours was done in 2019. The CCA, as you all are aware, is something that is normally done within months or a year, or in some cases, some countries are not even able to complete within a year. But in our case in Sierra Leone, we are able to have our CCA done within 6 weeks, and we did it alongside the development of our strategic plan for 5 years, and we are able to successfully have our CCA done and the SP, following which we saw the need to integrate civil registration, VS, and ID management for an increased service. And then in 2022, we now had a full-fledged electronic batch registration system. Up to date, we have a system, all the systems integrated, digitized, and based on our foundational system to support functional ID systems for tax administration, social security, immigration service, and et cetera, et cetera. So this is the journey we had from 1800 when when batch registration started in Sierra Leone to 2010, and government saw the need to adopt the API CRVS vision, and 2014 for an assessment on our CRVS and ID management landscape by Dr. Atick. And in 2016, we had a policy, a law that was enacted to have the National Civil Registration Authority. And in 2019, we had the CCA conducted successfully. And in 2022, we now have a full electronic batch registration system. And today, the systems are integrated in a way that functional IDs are dependent on our foundational ID system. Next slide. Now, you will see here between 2016 and 2022, we had those functions, those models of nullities, marriages, births, deaths, custody, divorce, adoption, etc., etc. Somehow fragmented, but we are a little linked. We are linked to the unique identifier, the NIN. That was between 2016 and 2022. Moving forward with the adoption of the policy in 2014, the laws, some of the policy formulations, now we now have an integrated system that you can see on the next part of the slide, that you have the eCRVS system that constitutes the NIN, and then from where every other module is tied, that is marriage, custody, death, statelessness, divorce, adoption, birth, etc., are tied to the NIN, the eCRVS system. That happens from 2022 to date. So you now use the NIN, the unique identifier, to support all of those functions or modules we are named here, and more that are not even named there, as well as supporting other sectors of government to access information on the population of this country. Next slide. Now you will see the coverage so far from that time. Before 2016, when it was the National Registration Secretariat managing just ID at that time, before 2016, you had about 7% of the population registered that were issued IDs at that time. And then between 2016 and 2017, with the establishment of the NCRA and the launch of the campaign, the massive registration, the campaign that developed the voter register and the initial data load for the civil register, you had about 70% done, coverage done in 2017. And then beyond 2017 to 2018, we had 75% of the coverage done. And then 2019 to 2021, because of some policy interventions, some campaigns that we launched to be able to account for the rest of the population, not wanting to leave anyone behind, we did what we call confirmation of information of people that had registered, just so that we validate their information, that we had then an opportunity for them to check with the authority. The information held with us so that they confirm that that was their information. In addition to the confirmation of their data, what we also did was for them to also give opportunity to those who had not registered to be captured. So we started the registration of residual cases in 2019. So 2019 to 2021, you now had about 85% coverage done on the population of the country. And beyond 2021 to 2022 and to date, because we have continued to register people, we have ensured that we don't want to leave anyone behind. We want to make sure that everybody's accounted for in this country, both citizens and other residents in Sierra Leone. We have now attained about 90% of the population of this country. They are all registered, they are all issued the NIN, and then they are in our system. Next slide, please. Now, this is also a summary of what it looked like. You have the civil registration. That is, you have 10% of the population so far unregistered. And I said to you that we have had about 90% registered so far. And disaggregating that by gender, you now have about 51% of female and 49% of male registered in the system. And going forward also to have adults and the under 18, you have 38% of children under 18 years accounted for, and 62% of adults accounted for in our database. These are all accounted for and all have their national identification number. Mind you, the NIN is established by law, and it provides for that once you are assigned an NIN at registration, that number lives, you live with that number until your death. And the law says that even after your death, it stays with you until 180 years. That is to say, it is non-duplicating, it's not replaceable, it is not reused, nor reassigned. So that, and the NIN has been so helpful in assuaging government effort, the challenges government has had in the past to restore sanity in so many other interventions that governments undertake in Sierra Leone. And next slide, please. Now, specifically on the birth registration, like I mentioned, about 10% in 2016 or before 2016, and under 1 year, you have 93% so far registered, and under 5 children, you have 90% registered. This is a source from the UNICEF report of 2022, and then this suggests that we are making progress in this country in terms of accounting for children under 5 years. Now you have, we just want to demonstrate the set of certificates we had in the past. One, on the left, you see before 2022, this was the birth certificate that we had. This one now did not have NIN, it didn't have security features, it was easy to fake. But 2022 to now, to date, when because of some policy interventions, we now have this birth certificate that is securitized, that cannot be forged, counterfeited, that is easily verifiable, and it's part of it's entered into our system, and the issuance of this certificate is accounted for. That is, who issues it, where it's issued is accounted for clearly by us in case of any attempt to do any forgery. And then, of course, the certificate is free, of course, that is issued from 0 day to 1 year. Government bears that responsibility. So we encourage parents to register the birth of their children. Next slide. Now, generally, an analysis of what we have done and the reasons for the policy changes and the policy formations have included digitizing our entire CRVS system with the act that is supporting that, because we have a legal framework supporting the process. And then from 2016, we've made sure that the system is digitized and it is linked to other ID services, so that using the NIN, they are able to carry out their responsibilities with ease. And then that has also addressed so much barriers that we've had in the past of vulnerable groups. And then we have made provision as well at the NCRA to be able to account for disabilities and addressed late registration for people, and then had policy to support all of these changes just so that we are within the brackets of the law. And the integration of birth registration into health and social services. We have made the policy in this country that going forward for enrollment in schools and many other interventions or services that we access in Sierra Leone is tied to your NIN that is on your birth certificate or on your ID. And at this level also, we have made use of strong coordination and collaboration with our partners, where we have the steering committee, the technical committee. All of these ones are structures established for us to interact with the partners, plan together with them, and implement CRVS and ID management function, so that we are able to account for whatever we do at NCRA, and we own up all that we do in Sierra Leone. And we have also made sure that we are able to capture stateless persons, and with support from the IOM and other agencies of interest. We have our services are decentralized across all the districts. We are now at the level of moving into sub-district level, that is at chiefdom level and ward levels, just so that we are able to account for everyone and to leave no one behind. But importantly, I wanted to mention is the unique or spectacular support political will we had in this country at the level of the president and even other policymakers. The level of support we've had from the presidency has helped transform the NCRA in a way that has gained admiration and getting so much gains in this country, because we are highly supported and we involve many other players, stakeholders that have bearing, either duty bearers in civil registration or have reason to have to access the data that we have on the country's population. Next slide, please. So this one just mentioned some of the regulations we have put in place from 2016 to 2022 to 2023 to 2025, largely trying now making sure that our system is integrated, where all of those vital events are put together. Our system serves as a foundational system to inform functional systems of Social Security, of Immigration Department, Minister of Finance, and also the policy intervention to restore the payroll dignity in this country, and thereafter a decision by government that for any enlistment into the payroll of government, you must have your NIN, and that must be validated or cleared by the NCRA. So all of these policy reforms and interventions have been able to support our work and to support the gains we are making. Also importantly is the use of the NIN for school enrollment or even in universities, etc., etc. And all of this we do by law, by our acts. We produce or publish annual vital statistics on the events that we cover, on the population that we account for every year, particularly on New Year's Eve.
Ambassador Massaquoi, sorry to stop you. Impressive numbers, impressive approach. So we'll come back to that in maybe a very quick Q&A afterwards. But thank you. Time is up. 15 minutes. So thank you. Let us move to Karin. Karin, we've gone through a whirlwind across the continent. We heard a lot of numbers. We've heard some scary things, but we also heard some very positive and encouraging things from the countries. Put it all together for us. Give us your sense and perspective. You've been in it for a while. You see it from the ground. So what does this all mean from your assessment?
Okay, so I'll do my best. As you said, it has been a whirlwind. So thanks so much, Joseph, and also thanks to ID4Africa for convening us. It's so clear that this livecast happening now is so important. I wanted to flag that this is the 35th anniversary of the African Charter on the Rights and Welfare of the Child. And Article 6 makes very clear every child's right to a name, to be registered immediately after birth, and to have the right to acquire nationality. So this is such an important moment to really take stock of where Africa is, where the progress is happening, where the progress is lagging, but also how we realize this right. And we know that African governments have prioritized birth registration. We've seen this in the Africa 2063 document, the Africa We Want, and we've seen it in the Africa 2040 for children. And it really talks about robust civil registration systems. So Joseph, I'll speak a little bit around the presentation of the data and then what it will take, the presentation from my colleague Bhaskar, and then also try my best to reflect on the 4 really rich presentations that my fellow panelists just presented. So a key takeaway for me from Claudia's presentation is about the steady progress overall across sub-Saharan Africa in the last 15 years. And this time period corresponds precisely with increased political commitment. And our panelist from Sierra Leone was just talking about political commitment and policy directives at the highest level, but also at the level of African ministers in charge of civil registration to reform and improve civil registration and vital statistics. And the approach has really been about how do we do this in a structured way, in a harmonized way. And the first conference of African ministers responsible for civil registration happened in 2010. And the ideas that resulted in the Africa program on the Africa program for accelerated improvement in civil registration of vital statistics were in 2009. And the results of this came about were coordinated, country-led, country-owned efforts between civil registration, national statistics offices, health ministries, justice ministries, really depending on the governance system of the country, which resulted in these public goods, promoting innovations and capacity building of these CRVS institutions. One of them, and I think all 4 presentations spoke about comprehensive assessments. And so one huge public good that came about early after this continental approach were the guidelines for conducting comprehensive assessments for national CRVS systems and for developing national CRVS strategic plans. And every presentation talks about that foundation. I particularly remark on the presentation from Sierra Leone, but also our panelists from Kenya spoke about that as well. I think another piece that comes out from the data piece from Claudia's presentation was the power and importance of data. And as you've reflected on that as well. And one thing that's come up in a couple of the presentations, again, just Sierra Leone, but also Kenya, was the production and use of vital statistics. And we see overall, Claudia presented on where the data for global and regional aggregates for SDG 16.9 come from. 41% of that globally is from vital statistics from countries' own civil registration systems. And it's great to see that countries are using and producing these data because it helps us with monitoring strategies, evidence-based strategies, but it also helps provide opportunities for course correction. The multiple indicator cluster survey, the household surveys are extremely important. They are done every 5 to 10 years. They won't help as much with the real-time data. So I think that's something that's important. And last year, UNICEF, together with the UN Economic Commission for Africa, UNECA, helped establish an expert group on child statistics. And I think this is the type of thing where we should be using these platforms to also be seeing how countries are coming up with their vital statistics data and reflecting and building on this more. To Bhaskar's presentation, a blueprint, a roadmap to rally around, he talks about the importance of investing in proven solutions. And we see that in the presentations. But a couple of key takeaways from that. One is, how do we twin with health? What are we doing to decentralize services to bring them closer to parents, to families, to communities? What are we doing on streamlining processes? And what a brilliant presentation from Tanzania in that regard. And then adopting digitalization as enabler. And I'll come back on that. These 3 strategies, so interoperability, decentralization, and digitalization, they've advanced birth registration by embedding it within essential public services and making the process routine, making it easier and more accessible for parents, for families across a range of settings. And colleagues reference settings such as refugee camps, but we could also speak, and I've seen it in the chat, situations of conflict and crisis, where we want to see these systems functioning. And then these strategies have been evaluated, and they continually are supported across conferences of African ministers, and they are core strategies for CRVS development in Africa. So coming now to my attempt to distill a few key things from the policy innovations panelists. How are these strategies being implemented across these different contexts? And what we're seeing is how they're leading to progress that's captured at this level of data at sub-Saharan Africa level. And we know that these strategies don't operate in isolation. They have to be supported by a number of enablers. And that's the strong and legal policy framework, which all of them have spoken about, all of the fellow panelists, the simplification and effective business processes, robust governance and coordination mechanisms, and then, of course, adequate human financial infrastructure resources. And without these foundations, the effectiveness and sustainability, and also being able to sustain these numbers, may be compromised. So if I can go into interoperability with health, the panelists from Côte d'Ivoire spoke about, and the first slide was about these key laws, memorandum of understanding between ministries of health, ministries and agencies responsible for civil registration, which involved quite a number of actors, the dedicated civil registration authorities, justice, the Population Commission, Registration Commission, and others. So when you formally integrate and you operationalize birth registration and you put it into maternal and newborn child healthcare services, including immunization, and you mandate health workers to act as birth declarants, and that was another point that came up, that removes the need for families to travel such long distances. So it makes the process accessible and efficient. And this is where we really see that jump in registration rates and also that sustained increase. And we've seen this in other places. You need these MOU because if you don't have them, if you don't have the laws, the roles are unclear and the collaboration between health workers and civil registration can be informal. So this really limits institutionalizing and sustaining birth registration. And we also need to see this around mandates. Health workers' engagement in birth registration will be much more optimized when it's not sporadic. It really has to be taken forward. The second one is around decentralization. And so this is really about, as all the panelists have said, how do we bring this service closer to parents and communities? How do we address barriers like distance and cost, including the issue about free registration and the first birth registration, first certificate free? So we saw that very clearly from the presentation, all of the presentations, but I'll particularly speak to Tanzania's, where Patricia very ably showed what the rates increased significantly as a result of a number of steps that were taken to bring about decentralization, this interoperability with health, the decentralization of services, and these streamlined processes. So parents could register births, they can immunize, they can get access to nutrition services all in one place. And of course, as I mentioned, the registration being free and the first certificate free is also critical to that policy change. We saw that also in Kenya, and I thought what was really appreciated with the reference were the increase in number of service points, but also the mobile units that are taking place in hard-to-reach areas and in refugee camps. We're really trying to avoid statelessness, and we see across sub-Saharan Africa many leadership, government leadership in ensuring that we are avoiding statelessness. Similarly, in Sierra Leone, it was also mentioned about this expansion in service points to bring the services closer to the population. So finally, on digitalization, and I think, one, again, this is about streamlining registration processes, how we improve data accuracy, how we support mobile registration, and different ways in which we can make the service accessible to populations that may be harder to reach. What's really clear is digitalization is not an end in itself. It has to be backed up by these efficient business processes, and they have to have these legal and policy frameworks. And all of the presentations mentioned this, the importance of protecting citizens' data and ensuring transparency. What we're seeing across sub-Saharan Africa is that the development of digitalization and digitized CRVS systems has modernized birth registration processes. But still, every country, and it makes sense, every country has a different context. All of the experiences are very different. But digitalization improves efficiency when it's undertaken as part of a much bigger effort to develop digital public infrastructure and is part of a whole of government approach, which requires a significant investment in infrastructure and also capacity building. I'll stop there. There were so many examples, and every single country panel presentation spoke to different examples of those 3 strategies, but those were a number of the ones that came up, and I also know that we want to keep enough time for questions and answers. So thank you so much.
Thank you, Karin. This is actually a fascinating summary. So if you did not catch one point or another, Karin provided us with a really, really good summary. Thank you. Actually, what I'd like to do, we do not have much time, but I'd like to give each country one question because there's just so many questions. I'd like to see if I could get them back on the screen and ask them those questions. So Tanzania, I'll start with you because that's the order in which you were supposed to come in. Tanzania, the question that was asked for you, you mentioned the issue of tradition where the name has to be available. It's a barrier to the registration process. And somebody was asking, can you actually register with a unique ID number, giving the people a grace period to come back and associate that unique ID number, which attests to a birth, with a name so that culturally they may have a month or 2 months to come back and say, we agreed on a name, but at least you have a unique ID number attesting to the fact that the human was born on this date and this is their number. So what would you say to that?
Well, thank you very much, Mr. Atick. I think it's a viable recommendation. Maybe we'll have to have a look on it. But I'll say that with these traditions, we have managed to link the birth registration and the vaccination. So once they don't have a name when the child is born, but we know that they will come back after 3 weeks, after 7 weeks. So by that time, at least the child will be named and we'll be able to register the child. But on top of that, we'll also advocate when the mothers, they do go for the prenatal services so that they are sensitized that they should have the names prior to the delivery of the babies. So, but I think that's a good recommendation. We will take it up and we'll see how we can, use it in order to improve our registration system. Thank you.
Wonderful, wonderful. Thank you for that. Ambassador Kodia, you and Sierra Leone actually are examples of countries where civil registration and national ID are actually integrated institutionally as well as perhaps at a system level. Do you care to comment on 2 things? One, do you think that's a viable strategy that every country should consider, that civil registration and ID should be tightly linked because the synergy is great? And if that is the case, how do you achieve the interoperability between the 2? Do you do it as a one platform, technological platform, or 2 separate platforms but with business rules that achieve interoperability? Je vais parler en français si vous voulez.
No, it's okay. It's okay.
Okay.
But maybe due to the fact that I can use some technical word, maybe let me go in French. So translate will turn it in English.
Okay, maybe we can bring in Diane quickly just to do a quick translation.
If she's not available, I can try.
She's here, but please speak in short and quick sentences.
Okay, thank you. Bien, ce qui est le plus important justement, c'est que le lien entre l'identité et puis l'état civil, là, il n'est pas discutable. Parce que c'est à partir de l'état civil dans un pays qu'on constitue l'identité. Dans notre cas, par exemple, comme nous sommes dans un système qui commence, il est important pour nous d'avoir le tout dans le même système. Parce que l'identifiant qu'on vous donne à la naissance, c'est celui-là qui va vous suivre jusqu'à ce que vous décédez. Et même encore, on fait le lien avec pour faire les arbres généalogiques et tout ça. Donc ça, c'est quelque chose qui est très, très important. Maintenant...
Un instant, s'il vous plaît. this link indeed is very important between ID and civil registration. This is not something that is can be discussed. And it's very clear that the civil registration is crucial in the constitution, in the creation of that identity, and especially in our country where this system is new and a new developing country. Then we have integrated all of this. And it is very important to have that civil registration also in the establishment of the genealogies of the heritage of the people.
Mais de façon pratique, c'est qu'il y a une étape qui est nécessaire pour tous les pays, c'est que quand vous commencez, vous êtes obligé de prendre en compte le fait que les données sont éparpillées. Et donc, il y a une phase transitoire qu'il faut regarder où on doit rassembler toutes ces données-là avec l'aspect légal qui suit, c'est-à-dire les gens qui n'ont pas d'état civil mais qui ont une identité et ceux qui ont une identité mais qui n'ont pas d'état civil. C'est ce que nous faisons et il y a des mesures légales qui sont prises. Donc, ça veut dire qu'en conclusion, il y a des mesures qu'il faut prendre, mais cela est bon parce que chez nous, c'est dans un seul système pour éviter qu'on puisse avoir des données différentes.
So in practical terms, there is one step that has to be done, which is a transitional step, is that at the moment, some of the data are scattered. So we are going through a transition where we have to gather all this information that was scattered before. And this is also implies in a legal point of view, because some people had only civil registration or other people only had their ID. So we had to make sure that everybody had both, and we created this one system where everything is integrated, and I think this is a good thing.
Thank you, Dr. Atick. I think that I've spoke twice, me and the translator, so it's okay. Thank you.
Okay, thank you so much for that, for your consideration. Actually, let me go to Kenya. In Kenya, there were quite a few questions for you, but one particularly, they said, could you please explain the mobile registration process? How does it work in Kenya?
Thank you so much, Dr. Atick. When it comes to mobile registration, first of all, we are considering the areas that are mostly affected. And we are talking of areas where we don't have these facilities like our registration offices, where the registration centers are actually far. Now, what normally happens is we organize for transport, we organize for materials, and what we do, we coordinate with the lowest administrative officers on the ground. We do sensitization, first of all, on the importance of registering these events as either births or deaths. And once we do that, we give them a time period that is actually mobilization. We mobilize them into centers, where now we give them a program on how we are going to visit them. Now, when that time comes, we normally carry with us the registration materials, including certificates, that is birth certificates and death certificates, where when we go there, now for those who are not registered, they come, they present the requirements. Once they do that, we do verification. Once we are satisfied, we actually register them on the spot and issue them with the documents, either a birth certificate or a death certificate on the spot. So it's a program that normally once we identify an area, we do a program which takes probably 2 weeks or 3 weeks, depending of course on the demand and the resources that are available.
But the registration is done on tablets? Is it done on tablets and connectivity is there to allow you to conduct that?
For now, for mobile registration, it's largely manual.
Okay.
As we are speaking, yes, it's largely manual. Of course, we are moving towards actually doing it, to automating the registration process, where we're going to have these electronic gadgets and where we're going actually to capture this information electronically.
Okay.
So that is actually the way forward, yes.
Okay, thank you for that. I have one last question for Sierra Leone. Is Ambassador Massaquoi with us, or we lost the connection? Operator? Yes, he's coming back. Okay. Ambassador Massaquoi, there were quite a few people who were impressed with the 90% rate. And one of the questions was, what are the proportion of children under 5 who are not registered? You have that 10% left over. So what do you think is the proportion of children under 5 in the country who are not registered?
We estimated that we'll have less than 4% of them of children, and the rest is adult. That is why we are very much aggressive in our search for the adult for all of them to be captured.
So 4% of the 10%, that's 6% adults, 4% children under 5.
Exactly.
Registered. Now, just one last quick thing. You have been very impressive in running campaigns. You run campaigns, you catch up, you get people up and running, etc.
Yes.
Do you believe that the sustainability of what you put in place can ensure that these numbers are not going to fall down? Do you feel like you've got sustainable practices, or this is a catch-up campaign that you've done, and we have to really worry about doing sustainable, durable things?
You should not be worried about it, because you have to make sure that when you catch up with these numbers, when you're able to register these numbers, you have to make provision for a continuous process, keeping in line with the principle of civil registration itself, where it's a continuous process. Every day, as people continue to give birth, events continue to occur, you must be there to be able to account for this event. But importantly, having policies or legislations or regulations that ensures or that triggers demand for services is very much critical. That assures sustainability of your campaigns. But by and large, it's not a one-off event. When you do it, you have to continue. You have to make provision where those ones, the residual cases, can always be accommodated as and when events occur. That makes it sustainable.
Wonderful, wonderful. So we're going to continue this discussion in the AGM. So let me thank everybody. Karin, thank you for this summary. I really think everybody needs to listen to it several times. It was excellent. So I want to move on to the next segment. It will be a brief segment, but it's an important one. And it's going to talk about the harmonization by creating an asset, creating a platform, the ACSA initiative, which, as you may have known, we've launched together with UNICEF and UNECA in 2023 as an official initiative, which subsequently was taken up by the African countries leadership. And so what we're going to do is we're going to let the leadership to talk to us about where does ACSA stand. Of course, ACSA means the African Civil Registration Shared Asset, and its intention is harmonization of practices across the continent. And I believe, operator, if I'm not wrong, if I'm not mistaken, I believe we have with us Josephine Mokesha, who is she was on a mission, but she's taking a sidebar. So could you please bring Ambassador Mokesha and Josephine, and also Ambassador Marius Mikpon'aï. Please bring them on.
Yes, Dr. Atick, both are here, and we're also bringing Bhaskar as well.
Yes, actually, Bhaskar, join us just in case something emerges. UNICEF has been acting as a consultant in this effort and has been participating. Okay, Josephine, welcome. Sorry you could not be with us earlier, but it's nice to see you. Please, the stage is yours.
Thank you so much. Thank you, Dr. Atick. Can you hear me?
Yes, perfectly, loud and clear.
Thank you so much for this opportunity to update on behalf of the ACSA Advisory Board and our partners, UNECA, UNICEF, Vital Strategies, and of course ID4Africa for the active role on this journey. So I'd like first to acknowledge the leadership of Ms. Henrietta Lamti, the former Registrar General in Ghana for birth and death, who chaired ACSA until February 2025. So we will soon have a new chair. So I serve as the vice chair, and Mr. Abdon is actually from Benin, is the member secretary. So he'll highlight later on the workshop that we had in Rwanda in February. So since 2022, ID4Africa AGM in Marrakech, we highlighted the need to have an asset where we can share knowledge, but also share experiences as we go into the CRVS digitalization journey. So this came out of the Mission 100 workshop that was co-chaired by UNICEF and attended by 27 countries, UNECA, and the World Bank. So the initiative known as Africa eCRVS Shared Asset was formally introduced in a workshop during the 2023 AGM in Nairobi, where it received very strong support from government and development partners. So it is designed to accelerate the CRVS system development across Africa and promote standardization tailored to the continent's needs. So this initiative aligns with the Agenda 2063, Africa We Want, which emphasizes the importance of establishing inclusive and sustainable economic growth and development through people-centered poverty eradication approaches. This also aligns with the recommendation by ministers responsible for civil registration in Africa with the Nouakchott Declaration call for cutting-edge research and resource materials to drive Africa's CRVS system forward. The African Union, UNECA, and UNLEA have stated the importance of a unified approach to digitize CRVS system, which enable cross-country collaboration and create a cost-effective integrated system. So the call allows for South-South cooperation and learning from each other as we apply recommended approaches and strategies for improving the CRVS system. So during the 2024 AGM in Cape Town, ID4Africa, an advisory board, one of the three main components of the ACSA, was constituted. The advisory body, the body is leads the process with technical and oversight support. In the previous session, you heard from my colleagues, Ambassador Christian Kodia from Côte d'Ivoire and Ambassador Paul Mwangemi from Kenya, two of the ACSA board members. So the other 9 countries include Angola, Benin, DRC, Egypt, Ghana, Senegal, Zambia, Zimbabwe, and of course, Rwanda. The 2 key components being worked on by ACSA include a resource package for design principles and standards. This package will define human and machine readable standards for CRVS digitization, ensuring interoperability across countries and systems. The second component is the validation of CRVS digital solutions. A methodology is being developed to validate CRVS solutions that meet ACSA standards. This will include open and private solutions. 2 technical working committees involving experts from UNICEF, UNECA, Vital Strategies, GIZ, the World Bank, and other development partners are working under the guidance of the advisory board. So the ACSA Secretariat, supported by UNICEF, UNECA, and Vital Strategies, provides technical and administrative support. ID4Africa helps coordinate and showcase ACSA's progress through LiveCasts, for example, this one, and also it allows us when we meet at the AGM to further enhance our collaborations. So in February, we held our first in-person workshop in Kigali, where we discussed both technical and operational aspects of the ACSA, and this was a very productive event. I believe my colleague Marius will give us more details about it. So this journey has been promising, and ACSA will benefit all countries regardless of their current stage, and even how far we are in our digitalization journey, including even Rwanda. It will allow us all to benefit from this ACSA. So now I'll invite my colleague Abdon to share more details from the Kigali workshop and outline the next steps for our initiative. Once again, I want to thank everyone for their support, and we look forward to continued collaboration.
Thank you.
Abdon?
Abdon, are you hearing us?
Merci.
Oui.
J'ai la parole?
Yes, it's going to be consecutive translation, so please speak in short sentences.
Thank you. Merci Joséphine pour cet excellent résumé de l'ACSA. Je profite de l'occasion pour remercier le docteur Atick et toute son équipe pour l'opportunité qu'ils offrent à la République du Bénin à travers ma modeste personne de prendre la parole à cette auguste tribune. Comme l'a indiqué Madame
Uh,
Joséphine,
Mm.
je fournirai de plus amples détails. Je
Traduction?
fournirai de connexion?
Traduction,
Ah, d'accord.
traduction. Il faut s'arrêter pour la traduction parce que c'est consécutif.
Thank
D'accord.
you. Thank you, Josephine, for an excellent summary of ACSA. I also take this opportunity to thank Mr. Atick and the staff for the opportunity to represent the Republic of Benin and as myself as this modest person and to be able to be here in this tribune.
Thank you. Comme l'a indiqué Joséphine, je fournirai de plus amples détails sur ce qui a été discuté et délibéré lors de la réunion de février à Kigali. Je profiterai également pour vous informer des prochaines étapes jusqu'en décembre 2025.
As informed by Josephine, I will provide further details in terms of what was discussed and deliberated in the February meeting in Kigali, and I will also take this opportunity to inform you on the next steps until December 2025.
L'atelier donc de haut niveau de Kigali au Rwanda a réuni les membres de ce conseil, des experts techniques et des représentants des partenaires, à savoir UNECA, UNICEF, Vital Stratégie et de la GIZ qui nous a rejoint en ligne.
The high-level workshop in Kigali in Rwanda brought together the ACSA Advisory Board members, technical experts, and representatives from some of our partners like UNECA, UNICEF, and Vital Strategies. And a representative from GIZ joined the workshop online.
L'atelier a été conçu pour s'appuyer sur des échanges virtuels antérieurs afin de favoriser un dialogue approfondi à la recherche d'un consensus et une planification concertée. Les discussions ont porté sur l'élaboration des principes de conception et de normes informatiques pour la numérisation des systèmes CRVS, ainsi que la mise en place de modalités globales pour évaluer la pertinence des solutions numériques CRVS.
The workshop was designed to build on earlier virtual engagements to foster in-depth dialogue and consensus building and collaborative planning. Central to the discussion were the development of design principles and IT standards for the digitalization of CRVS systems and the establishment of comprehensive modalities, global modalities for assessing the suitability of the CRVS digital solutions.
L'objectif affiché est de soutenir les efforts visant à soutenir technologiquement. L'objectif de soutenir les efforts visant à améliorer les systèmes CRVS et d'une manière à ce que les principes soient à la fois technologiquement robustes et adaptés au concept des pays africains.
These are intended to support efforts to enhance the CRVS systems in a manner that is both technologically robust and contextually appropriate for African countries.
Cet atelier donc est structuré autour de deux sessions, des chantiers techniques et des champs collaboratifs. L'atelier a souligné l'importance de la numérisation des systèmes CRVS interopérables ainsi que l'adhésion et du soutien des gouvernements.
This workshop was then structured around plenary sessions, technical work streams, and collaborative exchanges. The workshops underscore the importance of CRVS digitalization and interoperable systems, as well as government buy-in and support.
C'est le lieu de saluer le réveil observé au niveau de presque tous les pays africains et de rendre un hommage à tous nos gouvernants pour l'expression d'une volonté politique affichée en accordant une priorité au chantier de la modernisation des faits d'état civil sur les programmes d'action du gouvernement. Un clin d'œil de gratitude légendaire à l'endroit de nos différents partenaires.
This was an opportunity to give thanks to all and to highlight all the partnering governments that were working into the modernization of the systems.
Au thème donc du séjour de Kigali, voici donc les résultats obtenus. Le Conseil et le secrétariat ont exprimé des progrès accomplis, délibéré sur la voie à suivre et se sont mis d'accord sur les prochaines étapes afin d'obtenir des résultats tangibles prêts à être publiés lors de la conférence ministérielle prévue pour se tenir octobre-novembre 2025.
So in brief, these are the key achievements from the workshop. The advisory board and the secretariat have reviewed the progress, deliberated on the way forward, and agreed on the next steps to have a tangible outputs ready for release in a ministerial conference that is planned to be held in October or November.
Deux comités techniques ont été constitués au cours de cet atelier. Le premier, présidé par la Zambie, chargé d'élaborer les principes de conception et les normes informatiques, tandis que le deuxième, sous la responsabilité du Kenya, est chargé d'établir les modalités d'évaluation des solutions CRVS. Les deux comités étant composés d'un mélange d'experts en CRVS et d'experts en technologie de l'information, équitablement répartis pour mieux répondre aux exigences.
So the two technical working committees were formed during this workshop. The first one for developing the design principles and IT standards, and that is headed by Zambia. And the second one under the responsibility of Kenya, establishing modalities for evaluating digital CRVS solutions. Both committees have a mix of CRVS and IT experts that are fairly constituted to meet the requirements.
Les deux comités ont débouché sur des délibérations approfondies sur des principes de conception de normes informatiques et exigences fonctionnelles, étant donné qu'ils sont à la base des résultats.
Both the committees conducted in-depth deliberations on design principles, IT standards, and functionals, and functional requirements, since they are the foundational of both outputs.
Comme dernière recommandation, les rôles et responsabilités du secrétariat ont également été examinés et approuvés.
As a last recommendation, the roles and responsibilities of the secretariats were also discussed and agreed.
En ce qui concerne les prochaines étapes, les comités techniques sont en train d'affiner leurs résultats afin de clarifier la structure générale et le contenu des deux produits.
In terms of the next steps, the technical committees are in the process of refining their outputs and getting clarity on the overall structure and content of both deliverables.
C'est le lieu ici de noter et de partager avec vous la poursuite des consultations à distance et nous prévoyons partager les progrès des résultats globaux lors de l'AGA ID4Africa à Addis Abeba en mai prochain.
Further consultations are being done remotely, and we expect to present the overall progress during the ID4Africa AGM in Addis in May this year.
Nous entrevoyons également utiliser ID4Africa pour organiser une réunion d'une journée en présentiel du conseil consultatif et des comités techniques.
We also plan to utilize the ID4Africa event to have a one-day in-person meeting of the advisory board and the technical committees.
Ensuite, les comités techniques travailleront pendant le séjour à Addis Abeba afin d'affiner les résultats obtenus.
Following this, the technical working committees will continue working in Addis Abeba for the next 4 days to refine the outputs.
Après, donc, ID4Africa, en juin prochain, le conseil d'administration de ASCA travaillera à héberger les deux produits sur la plateforme GitHub afin de recueillir les commentaires de l'ensemble de la communauté CRVS, y compris les fournisseurs de solutions numériques CRVS. Un délai de 30 jours leur sera accordé pour la soumission des suggestions et commentaires.
In June, the ACSA Board will host both outputs on GitHub to gather feedback from the wider CRVS community, including CRVS digital solution providers, and a 30-day window will be provided for submitting suggestions and feedback.
Nous étudierons également la possibilité d'organiser un événement parallèle pendant l'Assemblée générale des Nations unies en septembre prochain à New York pour présenter les réalisations de l'ACSA à un public beaucoup plus large.
We are also exploring the possibility of organizing a side event during the UN General Assembly in next September in New York to showcase ACSA's achievement to a broader audience.
Simultanément, le Conseil consultatif de l'ACSA identifiera 2 ou 3 pays où les 2 produits pourront être expérimentés.
Simultaneously, the ACSA Board will identify 2 to 3 countries where both outputs can be piloted, can be experienced.
Après avoir donc intégré les commentaires de la phase pilote auprès des pays, les résultats finaux devront être prêts à être adoptés lors de la conférence ministérielle d'octobre-novembre. Cela marquera donc l'étape de préparation des résultats pour une mise en œuvre au niveau national et régional.
After incorporating feedback from the pilot test, the final outputs are planned to be ready for adoption during the ministerial conference in October or November. This will mark the readiness of the outputs for country-level implementation as well as regional.
Au cours donc de l'AGA d'ID4Africa à 10 en mai prochain, le conseil consultatif commencera à planifier la prochaine phase de l'ACSA qui se concentrera principalement sur l'évaluation des solutions CRVS numériques et des mises en œuvre au niveau national.
During the ID4Africa AGM in Addis, the advisory board will start planning for the next phase of ACSA, which will primarily focus on evaluating digital CRVS solutions and country implementations.
Permettez-moi, mesdames, messieurs les participants à ce présent atelier, de m'arrêter ici simplement parce que le temps s'en va et je m'en voudrais de ne pas remercier toutes les personnes impliquées dans ce processus et je me réjouis de l'idée de faire avancer cette initiative transformatrice.
Ladies and gentlemen, let me stop here, and also I would like to thank everyone involved in this process, and I am looking forward to thanking this transformative and innovative transformation to go forward.
Thank you. Thank you.
Madame Joséphine et moi, nous vous remercions et nous sommes à votre disposition pour répondre à vos éventuelles préoccupations. Je vous laisse la parole. Merci. Merci encore, Monsieur Dr. Atick.
Josephine and I thank you, and we make ourselves available to answer any questions or preoccupations that you might have. Over to you, Dr. Atick.
Okay, thank you. Thank you very much, both of you ambassadors. This is wonderful. I'm really excited to see that we're moving forward. We will not have time to do the questions here because we've got still another important segment we have to cover, very important. But we look forward to the continuation of this at the AGM, and I encourage everybody to come ready to engage with the ACSA team who will be at the AGM. So operator, I'm moving into the final segment, which is a very important segment about infant biometrics, which I believe you will see is a game changer. So stick around, don't go away, because this is going to be a very interesting segment. Let me say a few words about the origin of this, what has happened here. I'd like to say in 2019, ID4Africa launched a call to all researchers worldwide to see if infant biometrics could be captured and matched. The motivation was clear. If infants are able to be uniquely identified through their biometrics, many rights can be preserved, and the power of legal identity takes completely different dimension, because we can relate people to their origin, to their immutable evidence of existence. So I believe infant biometrics is the missing link that can render birth registration as the cornerstone of digital identity programs and can unlock support for civil registration programs. So this is the view that we're taking on this. But to solve this problem of infant biometrics, you need to demonstrate 3 key capabilities. First, you need to image the fingerprint of the infant without it coming up as a big smudge. Okay. Second, you need to manage to extract the minutiae, which are the structures that are essentially the ones that capture the identity. So you need to extract the minutiae using any of the leading algorithms. And then 3, you need to demonstrate that the pattern of minutiae is stable as the infant grows and gets older. In 2019, the first step was not even possible when we looked at the entire community and we brought them in to Johannesburg, South Africa, and we had them in a big workshop. And basically, the conclusion was, no, it cannot be done. Over the intervening years, several research groups built sensors which had double the existing resolution. In 2019, we were talking about 500 dots per inch. In the intervening years, they kept adding. So they did about 1,200 dots per inch. But even at 1,200 dots per inch, none of them could work. The challenge of building a high-resolution sensor that can capture the tiny details of the infant fingers remained until a few years ago, when a research group in Brazil seems to have made what appears to be a breakthrough. So let us listen to their progress and let us see how they are using this capability in maternity wards in Brazil to, in fact, help the world validate that infant biometrics can be a reality. So with us to talk about this is Felipe Hey, who is actually the chief of staff of the judge. Unfortunately, the judge could not be with us, but she has recorded a message, a video message, and Felipe will give you her presentation. And I assure you, there are very many interesting images and interesting conclusions that we're going to see from there. So, operator, could you please help me welcome Felipe Hey by bringing him to the stage?
Yes, Felipe is with us, Dr. Atick.
Okay.
Okay, so can everybody hear me loud and clear? Okay. Yes. So thank you, Dr. Atick, and the collaborators of ID4Africa, and thank you to the panelists so far for the enriching presentations we've had. Judge Mwangemi, unfortunately, could not be here today with us to speak. She's at a very important meeting with other presidents of courts of Brazil in other states. So we're very sorry. We have a short video, about a minute long, of her. Maybe Shauna could play it to us, please, if that's possible.
Hello, ID4Africa. My name is Judge Mwangemi. I appreciate the opportunity to discuss the involving legal framework surrounding biometric identification in Brazil, especially in relation to public security and civil rights. As part of this, I would like to highlight the important advancements such as the use of biometric data for infant identification, which is a part of a larger effort to ensure legal identities from birth. This initiative aligns with the spirit of the program Criança e Adolescente Protegidos no Estado do Paraná, established by Law Number 19634-2018, which ensures biometric identity documents for children and teenagers in Paraná. However, I regret to inform you that I will not be able to participate in this LiveCast, as I am attending a conference with all the presidents of the courts of justice in Brazil. Thank you for your time.
So thank you very much, Shauna and Dr. Atick, again for having us. I'd like to start saying that I was in South Africa in 2017, where I learned the word Ubuntu, which could be translated to something as I am because we are. So it's a pleasure for us in Brazil to open our arms to our African brothers and sisters. So let's continue. I think that Shauna will play the PowerPoint deck for us. That's right. Could we start with slide 1, please, Shauna, if that's possible? Yeah, thank you very much. So Brazil has long struggled with identity fraud, allowing individuals to obtain multiple IDs across different states. Recognizing the need for a unified and secure system, researchers and policymakers, Judge Mwangemi included, initiated efforts in the 1990s to establish a fingerprint-based national identification framework. One great challenge was the absence of reliable biometric identification for newborns, since traditional fingerprint systems were designed for adults and failed to capture the fine ridges and details of an infant's fingerprint. This limitation left infants without a secure lifelong identity record from birth. To address these, researchers embarked on an initiative to develop high-resolution imaging solutions capable of capturing infant fingerprints with precision. And eventually, Brazil developed a cutting-edge 5,000 dots per inch scanner, a 5,000 DPI scanner that ensures accurate identity verification from the very start of life. So how does the system work? Shauna, please, slide 2. Okay, so in this first step, yes, please play the video. That's nice. In the first step, the nurse enters the newborn's and mother's data into the computer. We saw in the first video. Please, slide 3, Shauna. Yes, just images of this first step. On the next slide, slide 4, please. You can play the video. Yes, please. It's a little bit stuttery, but it shows the nurse collecting the mother's fingerprints with the same device that will be used later for the baby. On slide 5, please. We have the image of the scanner. I think that's slide 6. We can, okay, well, it doesn't make a difference. So researchers in Brazil, as mentioned, developed a cutting-edge 5,000 DPI scanner, a 10-fold increased over the last 500 DPI. And this allows for detailed fingerprint imaging at birth. This technological breakthrough that ensured that even the smallest ridges and minutiae were accurately recorded, enabling reliable identity verification, as we will show shortly. Okay, so that's slide 6, I think, with computer processing images. Could you play the video, please? Yes, thank you very much. Okay, on the 7th slide, we have the third step. Yes, okay. Could you play the video, please? Yes, that's it. That's a very nice video showing the breakthrough itself, the nurse collecting the newborn's fingerprints with the device, which is a USB device. On the next slide, I think it's number 8, we have more images of this, let's call it the third step. Yes, so this baby with in the picture is 2 days old. So as far as we know, the device could capture the fingerprint image of the newborn right away. But for ethical reasons, we tend to wait at least 24 hours, maybe 48, till this procedure takes place, because in many cases, if not all cases, mother and father just want to get to know their child. So we wait a bit. So anyhow, a critical question in infant biometrics has been whether fingerprints remain stable over time. And research provides strong evidence that while an infant fingerprint grows in size, its ridge structures and minutiae remains unchanged. And cross-age matching tests confirm that fingerprints taken at birth can be reliably linked to prints taken months later, as we will show. So in slide 9, please. Yes, just more images of a 2-day-old baby getting the fingerprint collected by a nurse. On the next slide, slide 10, we have the fourth and last step, checking if the data was properly registered into the computer hardware. On the next one, this, please, Shona. Yes. So after successfully, capturing infant fingerprints images at high resolution, the next challenge is analyzing said images for meaningful biometric features. And as I told you earlier, although a newborn's fingerprint is much smaller than an adult's fingerprints, its key elements like its ridges, valleys, and minutiae are already present. The system isolates these features, enabling accurate biometric identification, ensuring accurate matching over time, as we can see in slide 12. Thank you. So the device captures, these are the raw images side by side. On the next one, we have raw images with minutiae. You can pass that, please. Yes, thank you. So raw images with minutiae. On slide 14, we have, next one, please. Yes, so are the side-by-side segmented ridges. Okay, on slide 15, next one, please. We have the ridges with minutiae. Please, the next slide and the final slide. I try to be very, very short and brief about it. We have some contact info via QR code. Simply point the camera to the QR code. I should have linked my LinkedIn so you could reach me, but you can also reach me there over the name that's on the left part of the screen. We believe that the success of infant biometric identification in Brazil with the program Crianças e Adolescentes Protegidos no Estado do Paraná, which was idealized by Judge Mwangemi, sets a strong precedent for further adoption. We have a state law in Brazil, ensuring that biometric identity documents are issued for children and adolescents, and it's being expanded to other Brazilian states. So policymakers, biometric researchers, international organizations, and enthusiasts, feel free to contact us. We are not by any means commercial people. We are not selling this device. We're just happy to assist with the development of legal frameworks. Judge Mwangemi is a pioneer and an absolute expert in the subject. And thank you.
Thank you. Thank you very much, Felipe. Ladies and gentlemen, you've heard it here. This is definitely something very, very promising. We do not pretend that the facts and the testing has been completed, but I have not seen in the last 10 years something as promising as this that could give us finally the possibility of establishing legal identity from the start. Clearly, this is the beginning. This is not an end result because there are lots of issues leading to legal frameworks, protection, guardrails, consent. Here we're talking about an infant that has no power of recognition of what's happening to them. The parents have to be implicated. So there is a whole lot of things that have to be discussed and addressed. And that's important for the community to be working at the international level, because this is not going to stay just in Brazil. This is going to become a worldwide, if it's validated, it becomes a worldwide phenomena that will change how we look at civil registration and birth registration from the start. And it's very important that that we also understand that the infant biometric or the patterns of the fingerprint, yes, they do grow, but the algorithms seem to know exactly what happens as they grow. They scale up, but topographically they do not change. So relative to each other, my hope and expectation is that we could relate somebody 18 years of age, the fingerprint, to when they are 2 days old. Imagine if that's possible. Imagine if that's possible. The possibilities become very, very different than what we have today, because you have the direct link to your moment of birth. So Felipe, I want to thank you very much for being with us today, for at least tantalizing us with the possibility that this thing potentially exists. We look forward to continued developments in this field, to hearing about validations from the research community. And this is an ongoing call. ID4Africa made it in 2019, and you were one of the leading organizations in the world that have responded to that call in a very positive way. We would love to continue to hear from others. By no means are we saying this is a solved problem. We do not know yet the facts, but we have one responsibility towards our community. It is when we see something promising, we would love to bring it to you. It's our obligation to bring it to you, and it is for the community to collectively explore in all transparency. So, Felipe, please pass our sincere thank you as well to the judge for her generous sharing of this information with us and for her continued passion for the cause of legal identity from the start. So thank you so much.
Oh, I thank you. Thank you for the opportunity. It's been great, and we wish to hear from you again.
Thank you.
Thank you.
Thank you. Okay, so let me close. We reached the end of our event. So operator, so if we can so thank you all for sticking with us. This has been very, very interesting LiveCast. You've stayed with us more than 3.5 hours. That speaks loud and clear about the importance of the topic, and so be assured that our commitment to civil registration is intact and remains as strong as ever. And we will see you at the AGM. And we will continue this among many other topics related to legal and digital identity. So be well, and I hope to see many of you at the AGM. Thank you again. And thank you to all the speakers who took the time to be with us today.